Why does pelvic pain happen? And what can you do about it? We'll dive in on today's episode of Taking the Floor.
I was like, why all of a sudden is it so painful? And I thought it was vaginal dryness. I had no idea that perhaps it was due to the pelvic muscle being so tight.
And it was really painful, both just the weight on my stomach, pain it caused in my back, and then also my feet.
So I was like, okay, let me try this so I can prevent further pain, because when you're pregnant, you do get pelvic pain.
Welcome to Taking the Floor, the podcast from Hinge Health about pelvic health, movement, and taking charge of your well-being.
We're your hosts,
Kandis Daroski
and Bijal Toprani, and we're both pelvic health physical therapists here at Hinge Health. Thanks for being here.
Today, we're talking about pelvic pain. I don't think many people consider pain always to be a pelvic floor issue. And one thing that I think always shocks people that I work with is that this pain can actually be originating from the pelvic floor muscles. And in many cases, they just don't even consider it because they don't know the muscles are there in the first place. So it sort of, feels really random to them that pain could be originating from muscles in this area. But once they learn about the muscles and their function, they begin to realize that it's entirely possible to actually improve with exercises and different strategies, because they're very comfortable with exercise being a treatment for pain and other muscles of their body.
Yeah, and another thing that surprises people is that it's not uncommon to have multiple pelvic floor issues affecting you at the same time. So you might have pelvic pain while also dealing with urinary incontinence, for example. And I really like to think about this in the context of another part of your body. So if you think about a pulled hamstring, for example, not only does it hurt, so you're dealing with the pain of that, but you also might not be able to walk as easily. So you're also dealing with a functional issue, which is kind of like that incontinence issue that I was just mentioning.
But unlike a hamstring that, might be painful and has, maybe more of a straightforward approach to treatment or recovery, pelvic pain can often be a little bit more in depth or tricky to diagnose and treat. And I think that's because there's just so many factors that can lead to pelvic pain or influence the type of pain that somebody is feeling in their pelvic region. So it really does take kind of this holistic, whole body, whole person approach to be most comprehensive.
And because the pelvic floor symptoms and the diagnosis and treatment can be a little bit more tricky, a little bit more nuanced, that can actually lead to people feeling a little bit more confused about how to treat the pelvic floor symptoms, and it leads to a lot of misconceptions. A lot of people might think that their pelvic floor symptoms are because of something that maybe they did wrong, or maybe that's just the way their body is, versus the way they would feel about, maybe having pain in another part of the body.
Today, we're going to explore why pelvic pain happens, how we pinpoint the causes of your pelvic pain, and most importantly, what you can do about it.
It's so important to consider what pain means and what it's trying to do for you. It might sound weird, but pain actually has good intentions. We want to fight and struggle with pain, but it's actually your body and brain's way of trying to protect you. It's there to warn you about possible danger, alert you to damage, or force you to rest and recover after an injury. When it comes to pelvic pain, it can be a signal that something might be going on that needs attention. We know some people can get stuck in this cycle of pain, and it can be really hard to break out of it. We get it. You may not feel like thanking your pelvic pain, but considering the purpose of pain and what it's trying to do for you can make it feel a little less like a big fight or struggle. And that might help make more space for healing and improvement.
So where does pelvic pain come from? Pain of any kind is complex, and pelvic pain for sure. We aren't going to go into every single source of pelvic pain in depth in this episode, and we might be, diving into that in some future episodes. This is really just meant to be more of an overview so that you can learn more about pelvic pain and how to take action to improve your symptoms if this is an issue for you. So there are many issues that can cause pelvic pain, and it's quite possible that your pelvic pain may be coming from multiple sources or causes. We're going to laundry list a bit for you, but it's really helpful to understand these various sources of pelvic pain.
So, the first kind of pelvic pain I wanted to dive into is probably something that most people are very familiar with if you have a menstrual cycle. So, that's pain like cramps, that feeling in the lower abdomen or the low back. You can also get pain because of ovarian cysts. Or ovulation pain, which is like pain on the sides of your abdomen that can last for a couple of hours.
Another somewhat common source of pain could be infections. And so this might look like a sexually transmitted infection or pelvic inflammatory disease or even a urinary tract infection. I mean, anyone who's ever had a UTI knows how painful and just awful that they can truly be. These are usually accompanied by other symptoms such as fever or vaginal discharge, for example. So if you do experience any of those symptoms in addition to pelvic pain, it's usually a really great idea to just get in with your healthcare provider and rule those things out.
And then sometimes pelvic pain can be because of some more serious issues like endometriosis or pelvic adhesions, fibroids, vulvodynia, and also in some rare cases, cancer in that region can cause pain as well. And then there's nerve entrapment. So when a muscle gets really tight in a certain region, it can actually entrap or kind of squeeze down on that nerve. That's something that we see in carpal tunnel syndrome in the wrist or sciatic pain, but that can also occur in the pelvic floor. And the next thing that's surprising is that stress can be a component of pelvic pain as well. So whether that's kind of everyday stress that compounds on itself or larger stressors that come up in life. And then there can also be psychological trauma that can have an impact on your pelvic pain. And that's because the pelvic area has a ton of nerves connected to it. So anytime that there are nerves going to an area of the body, there's more potential for increased muscle energy. This means it can be highly influenced by your emotions, whether those are bigger emotions or smaller. So even as I mentioned, that typical stress, that kind of everyday stress that can happen from a busy day at work or a terrible commute, that can cause your pelvic floor muscles to feel more tightness or more tension over time, and that can kind of lead to pelvic pain. Traumatic experiences like sexual trauma, medical trauma, or a traumatic childbirth experience can also be a component of pelvic pain.
Now let's talk about the issue that our program is especially equipped to help you with, which is sort of that muscle problem. And what I mean by that is a tension or tightness in the muscles of the pelvic floor specifically, or maybe an imbalance of strength or flexibility in supporting areas like the hip or back. And as pelvic PTs, we use fancy words like hypertonic pelvic floor to describe the pelvic floor muscles that are really just holding a lot of tension and not able to function properly as a result. Also, there's just a lot of other parts of the body that are connected into the pelvic floor from this like anatomical perspective, especially the back and hip muscles. So imbalances in strength or flexibility of these areas can also cause the pelvic floor to become overworked, tense, and painful.
Now, when that pelvic floor musculature is tight or is painful, and that pain has been persisting for months or years, that's what we call chronic pelvic pain. And some types of pelvic pain, like pain during sex, can come from muscles that have learned to stay in a state of overprotective tension. As I just mentioned, pelvic pain can be connected to traumatic experiences such as abuse or medical issues like childbirth complications that keep your body in a state of hypervigilance. If your body's alarm system is on high alert, you may notice that movements that used to feel safe now trigger a pelvic pain response, and activities that weren't painful in the past start to hurt.
So I know that so far we've been kind of talking about the more medical side of pelvic pain, which can feel a little bit thick. But let's now kind of shift gears and dive into what we're all here to talk about today, which is how we can sort of help figure out what the components of your pelvic pain are, and then even better, how you can address and treat those. Because part of our jobs as pelvic health PTs is to really be the lead investigator in your case. And that means that, we'll first probably start off by asking you a lot of questions. If you're talking to your pelvic health physical therapist about pelvic pain, they're going to be asking you questions about when your pain started and when it occurs within a day. Things like, is your pain constant? Does it occur at the insertional phase of intercourse, or is it with more deep penetration? And your answers to these questions can really help guide us and informing the exercise and lifestyle prescriptions that we would want to recommend to help with your specific symptoms.
Of course, as we just went over, the condition of your pelvic floor and lifestyle factors are not the only things that contribute to pelvic pain. Medical disclaimer alert. Some conditions need medical attention. If your pain is severe, doesn't go away after several days, or you also have symptoms like foul-smelling urine or vaginal discharge, bloody urine, heavy or irregular vaginal bleeding, or signs of an infection like fever and vomiting, you should see a doctor so they can examine you and make sure you're getting the care you need.
And similarly, when things like psychological trauma and other mental health factors are involved, really seeking out the help of a mental health professional can be a huge help as well. Also, I think that it's really important to say that often pelvic pain can be one of these conditions that really gets the medical runaround. And what I mean by that is that people get put through a lot of testing and they get passed from one provider to the next. And that in itself is really stressful. I am in my head right now thinking of a specific patient that I have had in the past who really had struggled with pain with intercourse for 35 years. So a true chronic problem that this person was having. And she had gone, to several different states, to probably at least 25 different providers over that 35 years, and she had never been able to really get truly the help that she needed. And so when she showed up at my office, she honestly was a bit skeptical, and she was maybe not so happy to be there with me, because she was already sort of thinking like, this might not work, and this whole process has been very stressful for me. And I just gave her some space to feel those things and let her kind of tell me about her story and really let her be in the driver's seat. And then, asked a lot of these questions that we've talked about along the way. And over the course of, the 10 weeks that we spent together, she really started to feel like this was something that could help her a lot. And she really put in the work. She was very dedicated, and she was able to have pain-free intercourse after 35 years of having that problem. And so all of that to say, I was able to see firsthand just how this really chronic problem that she was seeking help for over all of these years really compounded and created a lot more stress in her life. And it was great to see that she was able to improve and get help with the work that she was putting in.
Yeah, I think that what really comes out or pops out to me about this story, about this patient that you saw, is that, she was really probably feeling kind of fed up from all the runaround, and was starting to feel maybe feelings of hopelessness or whatever it may be, frustration, etc. But that it was really worth it all in the end to continue to pursue care for this, right? She was very persistent, which is something that I would applaud her on. And that it really is worth, trying to seek out care for this, because ultimately something she had been dealing with for like 35 years, you were able to help her in in like 10 weeks, which is pretty phenomenal if you think about it. So we really want to acknowledge that like all of the frustration and the stress around this and the runaround is really unfair and really frustrating, and it doesn't really help, in the moment, and can feel, not worth it to go through all these hoops, but we're hoping to really reduce a lot of those hoops. And at the end, getting the relief that you're seeking is really worth it. Let's talk about the good part, managing and preventing your pelvic pain. Obviously, we've talked a lot about how many factors go into pain and how some conditions may need medical or other treatment outside of physical therapy. But working with the PT and engaging with exercise therapy can also have a huge impact on pelvic pain. And often the two can work really well together and don't need to be siloed. You can be getting some kind of medical intervention and benefit greatly from exercise all at the same time. Many people don't even realize that exercises can help with pelvic pain.
That's right. And many people often associate pelvic exercises with leaking and like Kegels, which is a type of exercise we often recommend for strengthening the pelvic floor. But exercises that are actually intended to relax the pelvic floor can play a huge role in many different types of pain related symptoms, and they're a really big reason that members here at Hinge Health who are experiencing pain see symptom improvement. Learning to relax the pelvic floor is also called down training, and it doesn't just help with pain. It can also help with just becoming more intentionally focused on where the pelvic floor is and what it does. And some of the exercises that you might try if you have pelvic pain, and that a lot of our Hinge Health members are seeing within their exercise prescription, are things like reverse Kegels, which is intentionally trying to let go of the tension that you might be holding in the pelvic floor. Diaphragmatic breathing, or some people call it belly breathing, which is kind of this focus on really taking deep breaths in to promote relaxation, not only of the pelvic floor, but of the entire body system. And then relaxing stretches, think of things like the happy baby pose or butterfly pose. Those are ones that are really targeting not only the pelvic floor, but also targeting some of these connecting muscles like our groin and low back, and making sure that we're restoring flexibility in those areas as well.
Yeah, and I'm glad that you mentioned breathing, because breathing is a huge part of this. You'll probably see some breath-focused exercises in your playlist, and you should check out our guided breathing modules. These are meditations focused on helping you understand your pelvic floor and learn to relax your body and calm your nervous system, which is super helpful for pain. Pelvic pain patients often have a nervous system that's in overdrive, which can contribute to or even cause pain. So a mind-body intervention like this can make a huge difference.
And since you mentioned sort of this system that's on overdrive, I also want to make sure we talk about some other factors that can make a difference in pelvic pain, like stress, sleep, and even diet. One thing I always like to think about is sort of categorizing pelvic health into like 4 pillars, which is really looking at the movement or kind of the exercise portion of what you need to be doing in order to improve your pelvic health, looking at your nutrition, looking at sleep hygiene, which is sort of a term we use to talk about, how the quality and length of sleep that you're getting might be impacting your symptoms, as well as stress management. And those 4 things kind of all come together to help create the most optimal pelvic health plan that you can sort of think about. It's all about being comprehensive. But one thing I always like to describe too is that you really want to be focusing on the things that you actually need to improve, which is where a pelvic health PT can come in and sort of give some advice, right? So maybe you identify that there are certain movements or parts of your musculoskeletal system that you need to work on. And you really nail down that, and you start to work really effectively on the exercises that are going to address that problem. And maybe your sleep hygiene's great and you go to sleep at regular time and you sleep really great. And that isn't a part that you really need to think about. So you sort of just check that off. I'm doing great there. And you focus a little bit more in on the other aspects of your pelvic health. Maybe nutrition's great and that's not something you need to worry about. Maybe it isn't going so great and you need to kind of intentionally focus a little bit more on the nutrition or stress aspect. And when you kind of think of it that way, it makes it really clear how you can develop a plan that's super effective to reduce your symptoms.
Yeah, absolutely. We're always going to look at the holistic picture and then tease out what's not going so well, what already is, and kind of personalize the plan based on that. Let's also bring it back to the idea of pain's good intentions, the fact that it's trying to help you out, and how shifting your mindset on pain can have an impact. Even if you feel stuck, just knowing that improvement in your symptoms is possible can make a difference. It's also all about developing a mindset for change. Change requires practice and patience, especially if you've been dealing with your pelvic issues for a long time. But change is possible, and just the awareness of that can be incredibly encouraging and helpful.
Let's go over the 3 most important things to remember from today's episode. First, it can be tricky to find the source of your pelvic pain, but your care team can help you figure out what's going on and next steps.
Second, no matter where your pelvic pain is coming from, exercise therapy and breath work can be a huge help. Exercises and breathing work for pain often focus on helping your pelvic floor and your nervous system relax, which makes a big difference for pelvic pain.
Finally, internalizing the mindset that change and improvement are possible might be the most important element of working on pelvic pain. You can get better.
In our view, taking care of your pelvic health is a non-negotiable. It's just as important as any other aspect of health. Let's do a quick check-in on how we're taking care of ourselves this week. What's your non-negotiable, Kandis?
I'm going to be having a baby not that far from now. And one thing that I have learned in my last experiences of being postpartum is that sometimes making appointments that you're going to need later on is really hard. And so I'm going to get my dentist appointment that I know I'm going to need way after the baby is born set up, because I've definitely made the I've made the mistake before where I just didn't schedule those things in advance, and then all of a sudden it's been way too long and I haven't been for my routine dental cleaning. So I'm gonna do that. I'm gonna get that set up, and I'm gonna make sure that it's at a time when I know I can maybe get somebody to watch the kiddos, so I'm not there with 3 little ones, which can also be kind of stressful. So I definitely need help being accountable with that one, because it's really easy to just not make the call. What are you thinking about this week?
Yeah, I feel like your prioritization kind of falls in my non-negotiable too. So my sister actually lives in Arizona and I live in New York. So we don't get to see each other super, super often, but we always commit to having a phone chat on Mondays. So my non-negotiable is that I commit to my phone chat with my sister, whether it's brief or it's long. Sometimes we talk for 2 hours. We have a lot to talk about. She's just as chatty as I am. But even if it's a quick check-in, hey, how are you doing? How's your life? That's a non-negotiable for me, because I think that, the community and the family aspect are just really important things in life. So that's mine.
That was so heartwarming. Thank you for sharing that. And thank you all so much for listening. Be sure to check out the show notes for some helpful links and articles to learn more about pelvic pain. And remember, if you're dealing with pelvic floor issues, you're not alone, and we're here for you. The information contained in this podcast is intended to be used for educational purposes only and does not constitute medical advice or treatment for any specific condition. Please consult with your healthcare provider with any questions you may have about your medical condition or treatment. Check out your Hinge Health app library for new episodes coming soon.